Welcome to the Assembly Committee on Health and Human Services. Would the Secretary please call the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Here. Assemblyman Hafen. Here. Assemblyman Hibbets. Here. Assemblyman Koenig. Here. Assemblywoman Newby. Here. Assemblyman Wynn. Here. Assemblyman Ornlicker. Here. Assemblywoman Taylor. Present. Assemblywoman Thomas. Here. Chair Peters.
Ooh, and I am here. I think we have everybody today. Thank you all for being here. We have 4 bills on our agenda. Oh, quick housekeeping. I'm gonna make it real quick, please. Please silence your electronic devices so we're not interrupting people. Public comment will be at the end. You can provide testimony in a variety of ways, but they're all listed on the agenda. And please turn the microphones on and off as you're speaking so we don't get reverb. We'll move on to our hearings, and we'll start with Senate Bill 221, which revises provisions relating to Medicaid. Welcome, Senator. Thank you for being here.
Good afternoon, and thank you so much, Chair Peters and members of the committee. For the record, my name is Fabian Dunyat, and I'm proud to represent Senate District 10. Senate Bill 221 is a bill that revises provisions relating to Medicaid. Really quickly, this bill, many of you know Cure for the Kids is a foundation in Southern Nevada that specializes in pediatric cancer and rare diseases for kids. They have been struggling within the last few years with the reimbursement that they have, particularly for the patients that they serve. Within the last few years, fee-for-service Medicaid has been the top payer at Cure for the Kids, mostly because parents aren't able to work as often, and so the income distribution sometimes changes. The current rate methodology for provider type 20 results in reimbursement services that are less than the cost of providing service, and so this bill just pretty much creates a new type of category for the folks that, a special clinic for clinics that provide services primarily to children with cancer and rare diseases, so that we can close the gap that they're experiencing financially. That concludes my presentation.
All right, folks, are there any questions? I see that you got the appropriations in the other house to enable the Department of Medicaid. I always forget what that. Yeah, okay. We got Assemblywoman Thomas. Please go ahead.
Thank you, Madam Chair. And thank you, Senator, for bringing this forward. Just got a really quick question. What's the age group? You said children. I don't know, is it, birth through 18, birth through 21?
Pediatrics, Fabian Dunyati for the record, pediatrics are 18.
All right, thank you.
Any other questions? Seeing none, we'll move into, Assemblyman Hafen. Please go ahead.
Thank you, Madam Chair and Senator. I'm looking at looks like page 5 where looks like we're increasing.
Sir, this is a 2-page bill.
I'm on the wrong bill then.
Right.
But
All right, so we've got a couple of bills maybe together. It is a 2-page bill, and it's enabling language and an appropriation, and that is it. Any other questions? Seeing none, we will move into testimony. I would invite those who would like to provide support testimony to the desk. I don't know if we have a Las Vegas room. I'm not seeing a Las Vegas room, so if there's someone in Las Vegas, please turn the mic on and let me know. But I'm not seeing anybody coming to the table in Carson City. So BPS, is there anyone on the public line for support testimony on Senate Bill 221?
To testify in support of Senate Bill 221, please press *9 now to take your place in the queue. Chair, there are no callers to testify in support at this time.
Thank you. We'll move into opposition testimony. Is there anyone in Carson City who would like to provide opposition testimony? I was just notified we don't have a room in Las Vegas at the moment, so I'm not seeing anyone coming to the table. BPS, is there anyone on the public line for opposition testimony on Senate Bill 221?
To testify in opposition to Senate Bill 221, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in opposition at this time.
Wonderful. Neutral testimony. Is there anyone who'd like to provide neutral testimony in Carson City? Seeing none. BPS, is there anyone on the public line to provide neutral testimony?
To testify in neutral for Senate Bill 221, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you. I would invite the bill sponsor. No closing remarks. And while I have folks, I'm going to close the bill hearing and open the work session on Senate Bill 221. Are there any questions? Seeing none, I would entertain a motion to do pass from Assemblyman Nguyen and a second from Assemblywoman Gonzalez. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion passes unanimously. Great. We will move on to the bill hearing for 118. I do believe we have several folks in the room and potentially folks on, do we have anyone on Zoom? Okay. Open the bill hearing on Senate Bill 118, which revises provisions relating to public health. Please go ahead.
Thank you so much, Chair Peters. Fabian Doñate for the record. We'll make this one quick as too. So I have folks to answer questions if the committee members have, but the presentation will probably be a minute. So this bill revises provisions relating to public health. There are two things that you should know. Number one, we are striking that to join a health district, you have to be adjacent counties. This is so that rural counties, if they would like to join together to create a health district like we just did for the Central Health District in Nevada, they can do so, and there's no requirement that they're right next to each other. The second thing is it creates sustainable funding for public health. So in sections of the bill, you will see that there will be an appropriation of $15 million within pursuant to these sections beginning next year, and it will divide that money out to the different health districts throughout the state, so that way they have continual sustaining funding. There's going to be a fiscal cliff within the next few years because the health districts will lose federal funding once the COVID-19 pandemic funds end, and so this money allows them to continue on to fund those positions and respond adequately to future public health emergencies. With that, I believe there's one statement we need to make for legislative intent, but that concludes our presentation. So, Ms. Gutson-Dodson.
Joelle Gutman-Dodson for the record, representing Washoe County Health District today, and I can answer any other questions, but what the senator is referring to is that the legislative intent of this bill is that it will be included in the next biennium and therefore forward as a base budget in the governor's recommended budget. Excuse me, that was confusing.
Oh, that's great. And so this $15 million ask will be what sustains the directive of this bill, the intent of this bill for this biennium. And the expectation is that it will be baked into the base budget, so we don't have to have this bill next session.
Thank you for the question. And yes, so the $15 million will start next year. And then the intent of this bill is that we don't need to keep coming back here for one-shots because that's very difficult for public health to be able to plan and sustain. So it'll be built into the next budget. It's the intent of the bill.
Great. Are you ready for questions? All right, folks, do we have questions? This is an important topic. We've been working on this, I think, since at least I knew about it over the interim. Assemblyman Koenig, did you have a question?
I have more of a statement than a question, but a year ago, sitting as a Churchill County Commissioner, we created that central health district that Churchill Mineral and Eureka, which isn't contiguous, and so we were able to do that, and so this would make that codified, and what a benefit for the rurals by doing this, so thank you.
Thank you. And one more county is involved, Pershing County, and that's the Central Nevada Health District. And with this, they will receive 1.3% of That's the population total those 4 counties amount to, which is $195,000.
I was thinking Pershing was in there, but I wasn't 100%, so I didn't want to say it wrong, and I said it wrong by not saying it wrong.
Thank you.
Any other questions? Seeing none, we'll move into testimony. Thank you so much. I would invite those who are in support to the table here in Carson City, and then we'll go to the phones. Please remember to state your name for the record. You may begin.
Good afternoon, Chair and Committee. For the record, my name is Joelle Gutman Dodson, representing the Washoe County Health District. And I'd just like to take a moment to fully recognize how happy we are to finally be here. We've been waiting several years, a couple sessions, and approximately 119 days to get this bill in front of you today. And I wanted to really extend my gratitude to the LCB fiscal and legal staff. Without them, we wouldn't have made it this far. So thank you to Eric Robbins, and thank you to Wayne Thornley. The significance of this bill is real because public health impacts us every single day. We keep your water clean, your food safe, we immunize, test, monitor, investigate, prevent disease, and we manage emergencies. We are the safety net for every resident, and we are asking the state to invest in us. This was going to be my presentation, so it was more about the distribution of the money, but I just really want to recognize how hard a lot of people worked for this and how important sustainable ongoing funding is for public health. Thank you.
Thank you, Chair Peters. For the record, Bradley Mayer, representing the Southern Nevada Health District, and not to repeat too much of what Joelle said, but I think that the onset of the COVID-19 pandemic, for people who didn't know exactly what our public health agencies do, they found out. And I think one of the biggest challenges that we've had for a long time is that all of our funding is, a lot of our funding is really grant funding. It's categorical. We can only use it on the things that those grants are for. And so establishing, the Public Health Improvement Fund, through this bill, it has been an effort to give us money that's not categorical so that, as I kind of said in Senate Finance, we can actually play offense in the state on public health issues instead of constantly playing defense. And so we're looking forward, as we've worked through this bill originally, it was going to divert a portion of the other tobacco products revenue to this. We've it had been amended to get to this point, and this amount of money represents essentially what we're gonna do there. And we look forward, and again, to reiterate the legislative intent that this becomes ongoing sustainable funding, because that grant funding is not sustainable. We're constantly building up and tearing down programs as grants come and go. This will allow us not to have to do that, and to make some meaningful impact in public health in the state. And we thank you for your time. Thanks.
Thank you for the brief comments. Please go ahead.
Thank you, Chair, members of the committee. My name is Dakota Hoskins, Political Director for SEIU Local 1107. We strongly urge your support of this bill. We believe this funding will be extremely important for our communities throughout Nevada. As you heard, many of their health districts that the work they do here is super important, and we urge your support so that they have this funding. Thank you.
Hello, Elise Monroy Marsala here today on behalf of the Nevada Public Health Association. I have been before you many times on behalf of the Nevada Public Health Association this session, and I am the most excited to be before you today supporting this bill. In 2015, I was parachuted into the field of public health when I worked for Governor Brian Sandoval, and when I left the office, when the band broke up and we all had to find new jobs, I stayed working in public health for a number of reasons. But the biggest is that the people who work in public health in Nevada are absolutely amazing. And that is has absolutely been demonstrated with this bill by Joelle Gutman and Bradley Mayer, who were knocking on all of your doors probably for the last 119 days to get this bill through. So a great Nevada Public Health owes a debt of gratitude to Joelle and Bradley for their work on this bill. NPHA is a membership organization made up of Nevada's public health experts, and they act as a convener in the public health space. They meet on a regular basis, weekly actually, during the legislative session to follow bills, and they will continue to act as a convener as the state's public health infrastructure and this funding is used to take shape and build out that infrastructure. And we look forward to, hopefully I look forward to sitting back here next session supporting sustainable funding in the governor's budget. Thank you. We urge your support of the bill.
Good afternoon, Chair and members of the committee. Jennifer Berthume, Government Affairs Manager at the Nevada Association of Counties. On behalf of our members who represent all 17 of Nevada's counties, we're in support of Senate Bill 118.
Good afternoon, Madam Chair and members of the committee. My name is Allison Jenko, and I serve as the state's Public Health Resource Officer here today to testify in strong support of Senate Bill 118. I just want to quickly provide some quick context on this role and its purpose. The Public Health Resource Officer position was created through Senate Bill 424 of the 2021 legislative session to examine the state's public health infrastructure and provide recommendations on where Nevada can improve. Since being appointed to the role in 2022, there's one recommendation that consistently stays at the top of the list, and that is sustainable funding for public health. Nevada ranks last in the nation for public health spending, and this will not only increase our ranking, but give health authorities the ability to keep our communities healthy and our economy thriving. This bill also includes a provision to remove the requirement for counties to be adjacent in order to become a health district, and this is critical to the newly developed Central Nevada Health District, who will be officially going live on July 1st. Thank you for hearing this bill, and I look forward to seeing its passage.
Good afternoon, Madam Chair, members of the committee. I trust you're all wide awake this afternoon on the penultimate day. Steve Messenger with the Nevada Primary Care Association, representing the state's federally qualified health centers. We like to think of community health centers as the intersection of primary care and public health, and that's, shown in the Southern Nevada Health District, which is both an FQHC and a health district. There's a special designation around the country. These partnerships work really well, and I echo the comments of my colleagues. We look forward to them being more resourced, even stronger partners in the future. Thank you.
Thank you. Seeing no one else coming to the table in support, go to the phones. BPS, is there anyone on the phone line to provide support testimony on Senate Bill 118?
To testify in support of Senate Bill 118, please press star 9 now to take your place in the queue. Caller with the last digits 263, please press star 6 to unmute your phone.
We cannot hear the caller. Is there anyone else on the line?
One moment, Chair. Caller with the last digits 263, you are unmuted and may begin.
We are still unable to hear anybody, BPS. Oh,
One moment, Chair.
okay, thank
Caller
you.
with the last 3 digits, 263, would you please press star 6 to unmute your phone? Chair, that caller has dropped. One moment while I queue in the next caller.
Thank you.
Caller with the last 3 digits, 151, you are unmuted and may begin. Caller with the last 3 digits, 151, you are unmuted on our end. Would you please unmute your phone and begin? Chair, we're having technical difficulties with this caller connecting. Would you like me to move to the next caller?
Yes, please. And hopefully they can get connected here soon.
Good
afternoon, Chair, and the rest of the committee. This is Dora Martinez, representing the Nevada Disability Action Coalition, and we urge you to support this bill, and thank you.
Thank you, Ms. Martinez. BPS, any luck with the caller on the line, the other caller? We can move on to the next, if not.
One moment, Chair. Caller, you're unmuted and may begin. Caller with the last three digits, 151. You are unmuted on our end and you may begin. We are still having complications getting this caller to connect.
Okay, I'm going to run through opposition and neutral, and hopefully...
Yes, Chair, go on.
And then we'll come back to the phones. All right, I'm going to invite opposition testimony to the table. Is there anyone who'd like to provide opposition testimony today? Seeing no one at the table, we'll go back to BPS after I go through neutral in the room. Is there anyone who'd like to provide neutral testimony in the room? Please remember to state your name for the record.
Sheila Bray with the University of Nevada, Reno. I'd actually like to see if I can bump to support. Apologies for my tardiness here. So the University of Nevada, Reno would like to support. This bill would do great things, especially for our communities in the rurals, to expand healthcare access. Thank you.
Thank you so much. We will reclassify that as support testimony. All right, seeing no one else coming to the room, BPS, do we have any luck with the folks on the line? Please add the next caller.
Caller with the last three digits, 151. You are unmuted and may begin. Chair, we are still having complications with this caller.
Oh, I hope that they're able to figure this out. Always this is disappointing when folks aren't able to get their testimony in. And as a reminder, folks can always provide written testimony up to 24 hours after the hearing. However, 24 hours after this hearing will make things a little difficult. So as soon as possible would be the best way to do it. Seeing as we've gone through our testimony, I would ask the sponsor, you have any closing remarks? Okay, we're waiving closing remarks. I'm going to close the hearing on Senate Bill 118 and go into the work session on Senate Bill 118. Are there any questions? Assemblyman Hafen. Go ahead.
Thank you, Madam Chair. There was some testimony today presented that I'm kind of scratching my head. This is the first time I've seen this bill, and it looks like it's been a gut and replace. Nobody's talked to me about this. I do like the policy from what I'm reading, but I also don't appreciate someone coming and saying that this is going to be funded forever and that we're going to be tying future legislative hands. That's not how this process works. I will be supporting this bill going out of here, but I do want to make it very clear that each legislative cycle we make our own decisions on how we're going to fund things, and we will not be tying future legislative bodies' hands.
I appreciate the comment, and yes, we are all aware of the not tying future legislators' hands. However, the intent of this bill was something that we discussed in the interim committee, to be clear. It was we vetted this issue, policy issue, throughout the interim, in the interim Health and Human Services Committee, and that's why this bill came to fruition. It looks like there has been a lot of work done on it. We really appreciate the stakeholders who have participated in that process, and it looks like it's in a good spot at the moment. Are there any other questions from the committee before I take a motion to do pass Senate Bill 118? Seeing none, I would entertain a motion. Thank you, Assemblywoman Taylor, and a second from Assemblywoman Gonzalez. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? The motion passes unanimously. Thank you so much. We will move on to Senate Bill 191. Yes, Senator, welcome to the committee.
Thank you, Madam Chair and members of the committee. I appreciate the hearing this afternoon. I'm here to present Senate Bill 191. I'm Senator Heidi Sievers-Gansert. Senate Bill 191 has a couple pieces to it. You know, first, it extends Medicaid coverage to those individuals with autism through the age of 26, so up to the age of 27, which is typically what we do with our regular health insurance. So if you have a child who's on your plan, you can get coverage all the way through 26. So this extends Medicaid coverage for those with autism, with young adults through the age of 26. And then the other thing it does is there was an error on the original bill when we created the board, which was, I think it was in 2017. So the Board for Behavioral Analysts was created, and we had this fee schedule, but because they'd never had a board before, Aging and Disability Services within the Department of Health and Human Services took care of the board, essentially. They didn't know how to run a board, so Aging and Disability Services took care of it. About a year and a half ago, those duties were turned over to the individuals who now serve on their board and the executive director, and they realized there was a typo in the fee schedule. So when you look at the initial license fee, it used to be $25, again, for the initial license, and it was supposed to be $450, and that's for behavioral analysts and assistant behavioral analysts. And so that is in, those two things are the pieces that are in the bill, and that's pretty much it. So the fiscal note overall to provide those services is about $2.7 billion, but the general fund part is $788,000. So for the biennium, it's $788,000, and this has already gone through Senate Finance. Thank you.
Thank you. Are there any questions from the committee? Seems pretty straightforward. We appreciate the work being done on this and the appropriations to make it happen. We will move into testimony. Seeing no questions, I would ask folks in support to come to the table, and we'll go to the phones after. Seeing no one coming to the table for support, we'll go to the phones. BPS, is there anyone on the phone line for support testimony on Senate Bill 191?
If you would like to testify in support on Assembly or Senate Bill 191, please press star 9 now to take your place in the queue.
Good afternoon, Madam Chair, members of the committee. Stephen Collins for the record. Stephen with a V. Collins as an Assemblywoman known in relation to Los Angeles Radio.
Thank you, Mr. Cohen. Add the next caller, please.
Good afternoon, Madam Chair and committee members. My name is Dr. Bridget Fernopfel. I am the current president of the State Board of Applied Behavior Analysis, and we are in support of this bill. Thank you.
Thank you. Next caller, please.
Hello, with the last 3 digits, you may begin.
Hi, my name is Lauren Beatty. I'm the owner of Behavior Evolution, and I am in support of this bill. I'm a board-certified behavior analyst working with teens and young adults.
Was that the end of the testimony? Thank you so much. We'll move on to the next caller, please.
Good afternoon, Madam Chair and the outstanding committee. This is Dora Martinez representing the Nevada Disability Action Coalition, and we appreciate all you do, and we support this bill, and thank you to the sponsor. Thank you. Come on.
Thank you, Ms. Martinez. Are there other callers on the line?
Yes, Chair, one moment. Caller with the last 3 digits, 418, please press star 6 to unmute your phone. You are unmuted and may begin.
Hi, I think I already said this a minute ago. My name is Lauren Beatty. I'm the owner of Behavior Evolution. I'm a behavior analyst, and I work with teens, young adults, and hopefully adults. I'm in support of Senate Bill 191 because it would help families who have autistic adults get jobs and be able to live independently. Thank you so much.
Thank you. I thought there was probably more to that testimony. I appreciate you waiting to give us the full breadth of it. Are there other callers on the line?
Callers, if you have recently joined and would like to testify in support of Senate Bill 191, please press star 9 now to take your place in the queue.
Hi, this is Michelle Scott Lewing. I'm president for the Autism Coalition of Nevada, and we are in great support of this bill and greatly appreciate all of the work that's been done by the by everybody involved. Thank you so very much.
Thank you for the testimony. Are there other callers?
Caller with the last three digits, 109. You are unmuted and may begin.
Hi, my name is Molly Halligan. I'm the Public Policy Chair for the Nevada Association for Behavior Analysis, and I am calling in to be in support of SB 191 and to thank everybody that has been so supportive of us in this journey. Thank you.
Thank you. Next caller, please.
There are no other callers to testify in support at this time.
Thank you so much. We'll move to opposition testimony. Is there anyone in Carson City who'd like to provide opposition testimony? Seeing no one coming to the desk, BPS, is there anyone on the public line to provide opposition testimony on Senate Bill 191?
If you would like to testify in opposition to Senate Bill 191, please press star 9 now to take your place in the queue. There are no callers choosing to testify in opposition at this time.
Thank you so much. We'll move into neutral testimony. Is there anyone in Carson City who'd like to provide neutral testimony? Seeing no one coming to the desk, BPS, is there anyone on the public line for neutral testimony?
If you would like to testify neutral for Senate Bill 191, please press star 9 now to take your place in the queue. There are no callers choosing to testify in neutral at this time.
Thank you so much. We'll sponsors waiving closing remarks. We'll close the hearing on Senate Bill 191 and we'll open the work session on Senate Bill 191. Are there any questions before I take a motion? Seeing none, I would entertain a motion to do pass Assemblyman Nguyen and a second from Assemblywoman Gorlow. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes with those present. Thank you so much, Senator. And we'll move on to Senate Bill 385, where we have a pitch hitter. I think I'm saying that right. For Senator Neal and Senator Doniate, I believe, will be presenting this bill. I just want to give folks a brief warning that when this happens, sometimes our questions may not have direct answers or may take a moment. So we will have some grace while our friend helps walk us through this bill. We'll open the hearing on Senate Bill 385, which revises provisions relating to healthcare, which is so descriptive. And Senator Doniate, please go ahead.
Thank you so much, Chair Peters. Fabian Oñate for the record. Here on behalf of Senator Neal, who had to be downstairs. Once again, I am not the bill sponsor, but given that this bill started on the Senate side, I can walk through the policy provisions and I can answer the questions to the best of my capacity. Senate Bill 385 revises provisions relating to healthcare. It has a few provisions. In Section 1 of the bill, it essentially states that if a patient will be released from a hospital to his or her residence or a rehabilitation center, and a dietitian is assigned to a team of persons formed by the hospital shall ensure that the patient or the person with the primary responsibility for the care of the patient meets or knows how to contact a dietitian. So there are several cases that Senator Neal illustrated in where oftentimes when folks have debilitating diseases or if they have an injury, they might not have the capacity to understand what diet they're supposed to be on for their particular condition. And this ensures that if a patient falls into that circumstance, that they are given the rightful tools as to how to maintain their diet, and that patients and their family members are educated as to what is appropriate. As you know, some patients may have feeding tubes, some may be on clear liquid diets, a whole wide range of issues, and so this is to ensure that the patient is taken care of when they are discharged. The other provisions of the bill that she has deal with Medicaid. In later sections of the bill, as I'm flipping through this, Section 9.4 on page 11, to the extent that federal financial participation is available, the director shall include under Medicaid coverage for the filling of cavities, the fabrication, preparation, and placement of temporary crowns, the removal of dentures to improve chewing and aesthetics. And then Section 9.8 does a similar federal financial participation, and that's for the director to include under Medicaid for polycarbonate lenses. And so this is a request that seniors and folks of the community have asked her to undertake. And so that is essentially the provisions of the bill. The final sections are the appropriations that, now that it's made its way through Senate Finance. With that, Chair, I'm happy to answer any questions.
Thank you so much. And reading through this bill, it's very good. I wish we had more that we could put towards the dental piece in particular. I don't know if y'all have seen this, but some of the correlation of the aesthetic value of our mouths and how that impacts our well-being, our mental and behavioral well-being, is really profound. So being able to provide coverage for dentures that can really help elevate the quality of life for people. So I really appreciate this piece of legislation. Are there questions from the committee? Seeing none, we'll go, oh, yep, please go ahead, Assemblyman.
Explain the polycarbonate lenses part.
Thank you so much, Assemblyman Fabian Iñarte, for the record. So this is a provision that Senator Neal had that constituents had requested from her, from my understanding, when she did the presentation in Senate HHS. In Section 9.8, it requires that Medicaid provide coverage for polycarbonate lenses, and the provisions, therefore, are a provider of healthcare to provide documentation concerning the reasons using a polycarbonate lenses instead of any other type of lens, and that the recipient of Medicaid to try another type of lens. It also has provisions of what the department will do to make that amendment.
We're talking about glasses here.
Right.
So this would allow Medicaid to expand coverage into a couple different areas. Would you mind, Ms. Weeks, coming up to explain a little bit?
Just, yeah, because right now, I mean, I know if we have to apply for special permission to use polycarbonate, and so in this case, we can use it on everybody, but everyone else can't get polycarbonate. I didn't see that until just right now, my bad, but I'm like, whoa.
Madam Chair, Committee Member Stacy Weeks, for the record, Division of Healthcare Financing and Policy. We covered these services today, but yes, we do have to go through a process, as any taxpayer-funded program does, and federal law does require that. What Senator Neal is asking here for us to do is seek a waiver of those requirements. Whether or not federal government will approve that is unknown at this point.
Thank you so much, Ms. Weeks. Assemblywoman Gorlow, don't go too far. We might have another question for you. Please go ahead.
Thank you, Madam Chair. And I, too, had a question about the polycarbonate lens, because in a lifetime long ago back in Ohio, I was a licensed optician. It is not the best lens, especially for someone who has a very high astigmatism like I do. It makes me feel like I'm swimming. And people who have really, really thick lenses, they're actually better in a high index lens. So I know my colleague is an optometrist, and he's more up to date on some of the stuff that I've had because it's been over 20 years. But unless it's a child and we're looking at a safety issue, I probably wouldn't recommend as an optician to go into that lens for some prescriptions. So there's my comment.
Thank you for the comment. Any other questions or comments before we move into, yep, Assemblyman Hibbets.
Just a quick clarifying question on that part, just so that I understand it. It doesn't mandate that somebody has to use polycarbonate lenses. It just says if that's the best option for them, Medicaid can't say nope.
Madam Chair, Committee Member Stacy Weeks, for the record. No, actually what it says is that if a provider wants to prescribe that, they don't have to go through the process of explaining why they're prescribing it. So that's what it's saying, and I have to seek a waiver to be able to do that.
Thank you. Any other questions? All right, seeing none, we'll move into testimony. Thank you so much. We will start with support testimony in our physical location and then move to the phones. We see someone coming up in Carson City. Please remember to state your name.
Thank you, Madam Chair. Good afternoon. Steve Messenger for the Nevada Primary Care Association, representing the state's federally qualified health centers. We have been advocating and working on adult Medicaid expansion for the almost 8 years that I've been around. There's more than just the behavioral health benefits to the aesthetic value of your mouth. There can be serious linkages between your gut biome and what's going on in your teeth. It can lead to serious complications to diabetes and heart disease. And so there's a white paper that was circulated earlier in this session. I think it's attached as an exhibit to this bill somewhere, but it's the whole story of all the things that oral health can do for you. People who don't typically have access to dental benefits right now, adults on Medicaid, unless you're pregnant, veterans, unless you were injured in the mouth in combat, and seniors on traditional Medicare. So I think this is going to be a huge benefit to the health of Nevadans. I think it's a good investment, and we urge your support. Thank you.
Thank you so much. Seeing nobody else coming to the table for support testimony, go to the phones. BPS, is there anyone on the phone line for support testimony on Senate Bill? Oh my goodness, which one are we on, you guys? 385.
If you would like to testify in support of Senate Bill 385, please press *9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. We'll move to opposition testimony. Is there anyone in the room who'd like to provide opposition testimony? Seeing none. BPS, is there anyone on the phone line for opposition testimony?
If you would like to testify in opposition to Senate Bill 385, please press *9 now to take your place in the queue. There are no callers choosing to testify in opposition at this time.
Thank you so much. We'll move to neutral testimony. Is there anyone in Carson City who'd like to provide neutral testimony today? Seeing nobody coming to the table, BPS, is there anyone on the phone line for neutral testimony?
If you would like to testify neutral to Senate Bill 385, please press *9 now to take your place in the queue. Chair, there are no callers choosing to testify in neutral at this time.
Thank you so much. Would you like to have closing remarks? Waiving closing remarks, we'll go ahead and close the hearing on Senate Bill 385. We're going to go ahead and open the work session on Senate Bill 385. Are there any questions before I take a motion? Okay, I would entertain a motion to do pass. Thank you. I got a motion from Assemblywoman Newby and a second from Assemblyman Nguyen. Any discussion? Assemblyman Hafen.
As stated earlier, there are aspects that I do like, especially the dental portion. I'm going to look at this a little bit deeper, but I will vote this out of committee today and hopefully be able to get there by, I'm assuming, tonight.
I appreciate that. Assemblyman Gray.
Thank you, Madam Chair. Yeah, I'm going to pretty much just echo Mr. Haven's comments exactly. The great portions. I love the dental, especially when you look at cardiac risk factors and tied to dental issues. But I'll vote yes to get it out of committee and reserve my right.
Thank you. Assemblyman Koenig.
I'm not sure the polycarbonate thing makes a whole lot of sense to me, especially just talking about try another type of lens, but yeah, I'll still vote yes because I'm tired and this is still a little bit confusing.
I just a reminder that this is directing the director to look at covering these as the funding is available. It is currently not a part of the program, so it just is enabling language. Any other discussion before we vote? All right, all those in favor, please signify by saying aye. Aye. Any opposed, nay. That motion passes unanimously. Thank you all so much. And thank you, Senator Doñate, for your presentations and Doñate Day. That takes us to the end of our agenda for today. We're going to go ahead and do public comment and then go into recess. Is there anyone in the room who would like to provide public comment today? Seeing no one coming to the desk for public comment and go to the phones. BPS, is there anyone on the phone line for public comment today?
If you would like to provide public comment, please press *9 now to take your place in the queue. Chair, there are no callers choosing to provide public comment at this time.
Thank you so much. Folks, we are going to recess. Please be available if we need to go in for any emergencies or something unseen at this moment. With that, we are adjourned. Or, whoa, we are in recess.